Hi, my name is Amy Maslick. I'm a family physician here at UHS, and today I would like to talk to you about the common cold. As a doctor for the past 15 years, I have realized that a lot of people have colds. What I've also noticed is that not nearly enough people have talked about what causes colds or how to feel better, so I would like to talk to you about that today. First off, colds are caused by viruses. Why is this important? Well, it means good news and bad news, I tell my patients. The bad news is that antibiotics do not help viruses. The good news is that your body and its immune system are equipped to fight off the viruses that cause colds without the need of antibiotics. I also have more good news. There are many things that I can tell you to do as well as take to start feeling better. Before we even talk about medications, I am always emphasizing to my patients the importance of rest. When we're not well rested, we are more vulnerable to getting sick, and then when we are sick, our bodies are not fighting off infection as effectively because our immune systems are suppressed whenever we are sleep deprived. So it's incredibly important for you to get enough rest. Adults need between 7 to 8 hours of rest whenever they're healthy, so it's possible you'll need even more rest whenever you're recovering from illness. So when I'm seeing patients for cold symptoms, the first thing I ask is what symptoms are bothering you the most, and then I focus on those symptoms to tailor your recommendations for treatment to those symptoms. A common symptom of colds is congestion and runny nose. So if patients are suffering from their congestion, they usually are having fogginess of their head, they're feeling a lot of head pressure, and it's really hard to think. And certainly if they're blowing their nose constantly, they can't be taking notes during class. So often patients are seeking help for this. I recommend two things. One is a sinus rinse. Neti Pot is one brand, but any brand will do. Sinus rinses come both in squeeze bottle forms as well as a teapot form, and either way is fine, whatever you prefer. They work by flushing out the mucus in your sinuses so that you can relieve that pressure and just breathe more easily as well as think more clearly. As one patient has said, it's a game changer. The other medication I recommend is pseudoephedrine. Pseudoephedrine is a decongestant. It's a pill that you can get at any pharmacy showing your ID. And you can take it 1 to 2 times a day to help decrease that runny nose as well as that congested feeling. If you have any condition where you should not take stimulants, this is not a medication that you should take, and you should first ask your doctor. You should also not take it close to bedtime because it can keep you up at night. Besides congestion and runny nose, patients are also often experiencing fever and body aches in the beginning of their illness, usually the first 3 to 4 days. So if you're having these symptoms, I recommend one of two things, either acetaminophen or ibuprofen. Sore throat is another common symptom of colds. If you have that, there are several things that I'd recommend. Saltwater gargles are not fancy, but they are very relieving, and just make sure you have something tasty afterwards to get rid of the salty taste. People also often forget that sore throats are pain, so taking a painkiller like ibuprofen can help significantly. For adults, I recommend a dosage of 600 milligrams every 8 hours as needed. Besides saltwater gargles and ibuprofen, I also recommend lozenges, which can be very soothing, and also fluids. Some people feel better with the hot liquids like hot tea with honey, and other patients feel better with those cold, chilled liquids like ice water. Either way is fine and very soothing. A final major symptom of colds is cough. For that, I recommend a medication with dextromethorphan, which can help to decrease that reflex to cough. Besides medication, drinking a lot of fluids also helps to soothe the throat and also decrease that trigger to coughing more. So how long is all of this going to last? Because that's another question that my patients ask me. I tell patients that colds last 7 to 10 days. Usually the worst days are the first 3 to 4 days, and then after that it's usually getting better. If you have improvement, then worsening, or if you're having fevers past the first 3 to 4 days, those are both indications that you should call back and seek care because there might be something else going on besides just a regular cold. If you're watching this because you're feeling ill, I'm sorry to hear that, and I do hope that this video will help get you on the road to recovery faster.